Welcome to today's discussion on investments in AI digital health, risk, ROI, and future of care delivery. AI is no longer a distant promise. It is reshaping how care is delivered, financed, and trusted. But with innovation comes risk, data privacy, bias, regulatory uncertainty, and a lot of hype. At the same time, investors and healthcare systems are asking, what is the real return? Hi, this is Pankaj Gupta from EthAum Venture Partners. We are a zero BS revenue scaler and fund based out of Singapore with approximately 120 startups in our portfolio. Today, we have a pretty fantastic and diverse panel with diverse expertise and background, and who are going to share their insights and enrich us with a lot of fantastic ideas. I'll request our esteemed panelists to do a quick introduction before we get into the panel discussion. If I may request Piyush to go first. Piyush, please.
Thanks, Pankaj. Hi, everyone. My name is Piyush Gupta. I'm Head of Research and Innovation at ProHams and also lead the AI function within the organization. Thank you.
Fantastic. Thanks a lot, Piyush. And other than leading AI function, Piyush also spent almost a decade in the insurance industry. So I'm sure he's going to provide insights from AI and the insurance aspect of the business. So thanks a lot, Piyush, for joining us today. May I request William to go next, please? William?
Hi, everyone. My name is William. I am a chief leader at LyfPlus. And LyfPlus is a digital health company that's based in Dar es Salaam, Tanzania, but we also operate in 2 other countries. I have a background in science and tech, and today I'm with Ali, who's my co-founder, Kevin, who's also my co-founder, and we're happy to be here.
Fantastic. Thanks a lot, William. Appreciate your time today. I'm sure that you will share a lot of interesting insights from your entrepreneurial journey and how you have been dealing with the hospital systems and healthcare systems in Tanzania and outside Tanzania. So really appreciate your time, William, today. Philip, may I request you to go next, please?
Sure. Thanks for the invitation. My name is Philip Kiracofe. I'm CEO and co-founder of Startup Bootcamp Afrotech. My background, I've spent more than 30 years, both as a startup founder and in venture funds, both starting in the US during the dot-com boom, also launched one of the first US-India venture funds, and then have been running Startup Bootcamp Afrotech since 2017. So in our African portfolio, we have 70 African startups, including LyfPlus. So we're very privileged to have William as one of our founders. And then with our follow-on fund, Launch Africa, we're invested in more than 200 African startups. So that covers many of the sectors, including digital health, and really excited to share some insights today across some of those learnings.
Fantastic. Thanks a lot, Philip. And since you are funding the future unicorns, including health in the healthcare space, I'm sure you will have a lot of interesting insights on the returns, investments, what is the hype and reality in the AI world today. So really appreciate your time today. Dr. Mujtaba, may I request you to go next, please?
Thank you, Pankaj, for having me. Hello, everybody. So my name is Mujtaba Hemani, and I'm a medical doctor by profession. I've been into clinical expertise in my initial years and transitioned myself into health economics and health systems management with a diverse exposure into Middle Eastern countries, particularly in Iraq. And currently I'm saying hello all the way from a tropical place in a lovely beach in Zanzibar.
Thanks a lot, Dr. Mujtaba, for joining us today. You are the expert doctor in the panel today. So I'm sure you are going to talk a lot about how different AI systems are being adopted or where you see the challenges. So really appreciate your time today. Last but not the least, we have Daidipya Sharma with us on the call today. Daidipya, please, a quick intro.
Thank you, Pankaj. Thanks for the invite. Happy to be here. Hello, everyone. I'm Daidipya Sharma, business for Hexa Health. So we deal into surgeries and ensure the patient experience and hassle-free surgical journey for them. So we are trying to create space and understanding the problems of the hospitals ensuring the digital space is not impacting negatively, and are having a great experience when they are inquiring digitally and getting aware about all the things throughout the journey for them.
Thank you. Thanks a lot, Daidipya. And since you are digitizing the overall surgical space in India, I'm sure you will have a lot of interesting insights on how AI is being adopted today. So really appreciate your time today. Now, thanks a lot, all the panelists for the quick introduction. We will be diving into the questions really quickly. So my first question is to Dr. Mujtaba. And since you are probably evaluating quite a few AI solutions within your hospitals, I would love to understand why AI is becoming so central to the future of healthcare delivery. What kind of value you are able to see it unlocking that traditional systems could not do for you. So please feel free to share your thoughts on this.
Thank you again, Pankaj, and I guess I'm opening the floor today. I thought it would be the lovely lady. So yes, I believe the future of healthcare is no longer just limited to a medical perspective. Rather, it is in a collaborative system with more of data-driven, digital, and kind of a data intelligent area that we're working on. So if I give you a little bit of a context, like in terms of running hospitals, there is electronic medical records. It's not something new, even in this part of the world.
Right.
It's something that is coming up in most, if not all, of the health systems at the moment. And AI is not a distant idea. It's central because very simple. There's two reasons. There's volume, and then there's a lot of varieties. The volume of the patient creates a ton of data for us, and the variety of the data as well. It's not possible in human capacity to be able to deliver and to be able to utilize the data to the best level that we want to in terms of our outcomes and values. So recently, I was actually working with a UK-based primary healthcare group, and there's a beautiful application, see the signs, right? C for a C, and then see the signs. It's an early cancer detection model driven by AI, and it changed the percentage from, let's say, around it was 59% to 66%. So that doesn't sound like a dramatic rise, but until you realize that those numbers actually represent real people in the end. And that's where everything that AI brings on. And it's not just about the efficiency, rather it's about the transformation of our outcomes. And in other perspective, for instance, if I look at it in a different way in terms of someone running a hospital, this part of the world, there's a lot of shortage in terms of human resources, right? So there's a single doctor and a single nurse, let's say, delivering services to in a department of around 30, 35 patients were admitted there, right? So how does someone keep track of all of that? And EMR is more like a data filing cabinet, right? So it will just record your data for you, but and track your visits or give you information on clinical notes, but you actually need that person to have a co-nurse or to have an assistant running around as well, someone who is able to predict, someone who's able to anticipate, someone who will be able to even guide on the management so that the outcome of that patient is excellent. So that's where I see where we're going today, Pankaj.
And do you see this change in all kind of hospitals in Tanzania, in Africa, or it is very specific to Safi hospitals where you are, where you're working, Dr. Mustapha?
Right. So I see it everywhere. So as I said, like even in Tanzania right now, there's still many hospitals who are working on paper. So I was happy to hear Piyush is from insurance industry, right? So there's someone literally sitting there. He has a pen and a paper, putting down that folio, looking at the patient, trying to match those ICD-10 codes or 11 codes, trying to tally it with his prescription. And some of the people have actually migrated migrated from the paperwork, but more into an electronic medical record, which is in sense doing the same thing, but just digitally, right? So if AI is there, the person who's on the paper is definitely it's someone like who's on the runway right now, and AI is the jet fuel. So they're still constructing that path towards it. But once those who've already created it, that jet fuel is definitely going to improve outcomes, not only in terms of patient safety, but also in terms of an ROI, in terms of your numerics that we look at. So it's definitely going to affect in both areas.
Fantastic. Thanks a lot, Dr. Mujtaba. Let me turn to William, CEO and founder of LyfPlus. So, William, while you have been building the company, you do talk to probably a smallest clinic in Tanzania to a billion-dollar hospital group in India. From your perspective, what kind of gaps these hospitals are trying to solve using AI? And when you share your AI solutions or other AI solutions, do they really jump upon on these solutions quickly, or they have certain kind of hesitation? What's your opinion, William?
Absolutely. Thank you for the question, Pankaj. From what we see across the providers that we work with, the biggest challenge really is that AI and digital health have become a completely separate vertical. Very different from traditional healthcare operations. Most hospitals try to approach AI the same way they approach upgrading equipment or installing a new EMR. But the reality is, AI is not a software upgrade. It requires deep technical infrastructure, data engineering, interoperability layers, clinical validation, and continuous model monitoring. All this simply not what hospitals are designed to do. So, going further into this, there's issues with technical capacity gap. AI adoption requires full teams of data engineers, machine learning engineers, DevOps, clinical informatics, and integration experts. Even some of the largest hospitals cannot assemble or retain these teams. The hospitals are very intelligent in delivering care, but building AI requires capabilities like data normalization with standards like FHIR or HL7 mapping, identity resolution, and patient matching, building features across ETL pipelines, et cetera, et cetera. These are software company capabilities, not hospital capabilities. Another issue is to do with cost and risk gap. Building an AI solution independently can run into millions of dollars. Data infrastructure, engineering team, regulatory compliance, cybersecurity, and multi-layer year validation cycles. And about 80% of AI pilots globally never make it to production because organizations underestimate the complexity and lifestyle management. For hospitals on tight margins, the return on investment and going forward simply doesn't justify the investment. It's too slow, it's too expensive, and very uncertain. We could talk about speed to market gap. We could talk about issues to do with interoperability and data quality gaps. All that just to really emphasize that they're really not the business process of hospitals and healthcare providers were not built for this. And this is where companies like LyfPlus comes in, where we already have a number of partners. We're already generating data on a daily basis, and we have the capacity and the know-how on how to navigate this. So that's the gaps that we're seeing here, Pankaj.
So probably you don't have to do a lot of convincing on why this solution is necessary for you, but probably you have to make sure that they understand how they can optimize their overall operations, how they can optimize their cost with AI solutions offered by you or other AI solutions in the healthcare space. Is that the right assumption?
Yes, I mean, looking at it, I think it's the future of care. I think there are already a number of products out there that patients are already using, and these are not. I mean, they're not owned by healthcare providers. this shows you that there's already a change of consumer behavior. And eventually, I'm seeing that healthcare providers are going to adapt with it. So it's not only about LyfPlus. It's really about having to know how to navigate this and the best approach to go about it.
Okay. Anybody wants to add any additional point on this, on what William or Dr. Mujtaba just talked about?
Yeah, sure. I'd be happy to jump in. I think one of the so as an accelerator program, we're very see hundreds or thousands of applications a year for our program.
Right.
So, when we see a founder like William and LyfPlus, out solving the problems, the thing that's really exciting for us is that they are at the forefront. They, he and his team and the startups, and especially in emerging markets like Africa, are so critical because these are not global solutions applied to African challenges. These are African solutions for African challenges, and they're leveraging the big data models, and they didn't create AI, but what they're able to do is AI in and of itself is not the solution. AI is a tool, it's an enabler, but you still have to, as he was describing, you have to be able to apply it and to make it relevant. And the founders and the startups are uniquely positioned to understand the tech, understand the potential, but also to bring their medical backgrounds, their understanding of the patient experience, of the insurance profiles, all of the things that go into this, and that's where when we see this kind of this corporate startup collaboration, or organizational startup collaboration, that's where you get the best blend of solutions, that everybody is playing their part, and then investors can come in and can see the traction that a startup like LyfPlus is getting, and say, great, we don't have to, we can see that, we're not funding them, to go out, we're not going to put $1 billion to try to come up with a new AI model. We can see you've actually got traction. You are solving a real problem. You've got a real product in the market that the hospitals are using. So what we're just doing is accelerating that growth, but you've already proven that there's real demand, there's commercial viability to this.
Okay. No, thanks a lot, Philip, for jumping in. So now we understand that there are clear gaps, and hospital administration, healthcare ecosystem also understands this. AI is clearly creating value, unlocking value for these healthcare ecosystem players. And now I would love to get opinion from Daidipya on the adoption, right? So Daidipya, when you're working with Hexa Health, discussing AI solutions and investment innovations with your healthcare partners, hospital partners in India, what are the biggest roadblocks, limitations, concerns that you hear from your hospital partners? Is it about the talent, about the infrastructure cost, uncertainty of ROI, or they have this, perspective in their mind that, hey, doctors are always, 100x better than the AI, and we don't really trust AI, we trust doctors. What are the limitations? What are the roadblocks that you see in your day-to-day life?
So I think the roadblocks are always there. Whenever a new technology or new department or new category gets built up, eventually there is always a hesitation for the adoption. Uh, it's very difficult for a few people to understand AI is not replacement for them. You cannot replace the doctors, you cannot replace any person. It's only about adding more speed towards the innovation and the advancements which you are focusing upon. So earlier when we started, it was very difficult for us to get the adoption from the hospitals, from the doctors, that some new player is coming, so we will be more competitors to them. Down the line, over the years, they have understood that it is not only the adoption, we are not the competitors, we are actually the partners to them. We are adding more value to their business. We are actually more effective towards their cost, towards their marketing, towards their finance, towards their resource optimization. So I think now the adaptation has become better. Things have gotten better, and I'm pretty sure that down the line, over a couple of years, there'll be more advancements towards a lot of other things as well. So the adoption is getting better.
Okay. And do you think that they have required talent, in-house talent and infrastructure to support those new AI innovations within their organization, or they need to come to the speed? What do you think from that perspective?
I think to add speed, it will still take more time. They don't want to build infrastructure by themselves. They are still aggregators just to try it out first before making investments by themselves. They are hesitant towards having more partners onto their panel as well because they are not sure about the returns. The fact that hospital profits and hospital ROIs move in a slow manner as compared to the startup industry.
Right.
It's a long-term game. It's a 5-year, 10-year game. Knowing about that fact as well, they're still hesitant. It's not openly acceptable. The few of the bigger players who are there, who are having huge chunk of money, they are more open towards doing some risk analysis, taking some risks, taking some advantages, moving ahead, taking a first leap. But the other players, which is the majority of the market as of now, they are still hesitant. They are waiting, they are watching, they are just observing from the background and ensuring that they will not face any kind of losses before just jumping into the pool.
Okay, so big guys, big hospital groups have allocated the budget. They are more willing to adopt, try, test, and probably the small, medium-sized hospital groups are still sort of in wait and watch mode, which is which is pretty traditional or standard adoption model of any new technology that we see, even in enterprise space, which makes complete sense. And I will also like to get Dr. Mustaba's opinion on this. So while Daidipya is on one side where he's pitching, AI innovations to the hospitals, I think you are seeing or you are being pitched a lot of AI solutions to you. What kind of concerns you guys have at Safi or other hospitals when you are trying new solutions out, Dr. Mustafa?
Right. So the important thing is, I think, as you said, some larger networks like Saifi, we are already inclined, and we're actually, my EMR is called Shams, S for Saifi, HMS, so Hospital Management Software, and I'm already working towards being able to use those AI techs to myself. I would say the challenges are quite in terms of the other tech-related areas of focus. So, for example, we would require something to be working with, let's say, low bandwidth, or I have community health workers who probably would prefer an offline kind of friendly AI system for just their tablet, whereby they can just do basic nursing triage, or more particularly when you're going to different communities, there's something that has to be more culturally relevant. So you can't just copy paste something which has worked in country X, it's going to work in Tanzania as well. So I would say these are the key areas where I see challenges. And then we as the local partners on this side, now we have to sit with those developers. I'm not someone, I would call myself not tech savvy, but yeah, we're working with those people so that we're able to provide that output in the best way to our population.
So you have to create the basic infrastructure, the connectivity. You have to solve those basic issues before we talk about adoption of AI solutions, which makes complete sense. Fantastic. Thanks a lot, Dr. Mustafa, for jumping in. Now, I would love to get a perspective from Philip. Again, as I said, they have been investing in future unicorns, especially in the healthcare space. When you are investing in digital health or health AI kind of solutions, are you looking at today's inefficiencies, or you are going completely wild that, hey, this solution is going to bring some crazy innovation in the healthcare ecosystem tomorrow? The model of care delivery is going to look very, very different, drastically different 10 years down the line, because of this interesting solution where I'm investing. So what are your thought processes when you are investing in these digital health AI kind of solutions? Philip?
Yeah, so thanks for that. I mean, the great, we often talk about, the fact that, unicorns are mythical creatures, right? So in the African context, we're looking for gazelles, we're looking for camels, we're looking for, the animals, that we're investing into, are the ones, and the camels are kind of like, can go very long periods of time, with low water, survive in the desert, so there's a lot of great analogies that we can kind of bring in. But, But the reality is that in Africa you don't have to have this absolutely ridiculous complete out of the you don't have to be shooting for I'm going to put a reasonable rocket or go to Mars, like actually just very pragmatic solutions. There's 1.4 billion people living here, like if you solve a very basic problem, you've got an immense market. The other key thing that I think is that, but it's not about, so it really is the practical application of the tech. And we had the pleasure of working with William over our 3-month accelerator, and it was many intense conversations around potential pivots and like come with your amazing ideas, but also how can you sell this today? How can you get a real customer, solve a real problem for real revenue that you're solving today? Because that's what's going to propel your growth. But I also want to just talk about the difference in how successful startups really apply the AI and how creative they are. And maybe a simple example is to think about radiology. So you can use AI to look at a chest X-ray and say, is this cancer? Does this patient have cancer or pneumonia or tuberculosis, or is it healthy? But in order to do that, you need African lungs in the data sets. And one of the fundamental problems is that TB is really not something that exists, in most of the first world countries. So when you try to use your models and train them, they just don't work very well. So we've seen African startups that solve that by saying, okay, well, we will not be able to provide a high enough confidence level to go directly to the consumer, but what we can do is serve the radiologists who are in very short supply. So we can take 100 chest X-rays and we can rank order them from biggest risks to most healthy. And then the radiologists start, instead of a first in, first out model, the radiologists are actually working with, the ones that are most likely. And then, the AI can say, here's our proposed recommendations. Here's what we think is happening. But ultimately the radiologist is still responsible. So, some of the other panelists have talked about, tools that help the medical professionals versus directly benefiting the patients. And that's an approach that we see working very well in Africa. So, it's a lot more about B2B models or B2G, or in this case, B to B to hospital, versus trying to get directly to the end consumer. So you're enabling the doctors and the medical professionals and the people that are in the field, to do their job much better and more efficiently. You're not replacing them at all. Right. You're helping them to be much more effective. So those are the most exciting startups that we see coming through the pipeline now.
Okay, interesting perspective. And let me just change the question a bit. Would you have had a different answer if you were investing, let's say, in Israeli startups or in US-based startups? Then will you be looking for something 10 years down the line? What could change the ecosystem completely different?
I mean, yes, because the reality, I mean, let me just stick with the radiology, track for a moment. In countries like Tanzania, you have like one radiologist for 40,000 patients, whereas in a first world country, it can be 1 to 200, So, if you go in with a chest ailment, it could take days or weeks before someone can actually review that x-ray. And in that time, you could be dead. So solving just a simple problem of prioritizing, already has an immediate impact on saving lives. It already has an immediate impact on the resource utilization at the hospital, right? So the types of problems that need to be solved here are just very different. And I oftentimes talk about, in some of the first world, ecosystems, innovation and disruption is something that is really a luxury. I mean, they can solve problems, but if they don't do it, they all go back to other jobs. They get $1 billion payout. They get hired by somebody else. But in Africa, it's an existential reality. The founders like William are not doing this because they've, out of, like, oh, just fanciful idea. I want to be, I want to, own my own spaceship someday and blah, blah, blah. I mean, you're doing it because he sees the immediate results every single day. He can measure the benefits of his startup in real lives saved. And that's something that's profoundly different. So of course, we think that, and we've seen the innovations that come out of Africa ultimately can go back into first world economies. So African solutions will ultimately jump back, but the starting point is you don't have to have something that's only going to be exciting in 10 years.
Right.
You can already be solving something that's very exciting today.
That makes complete sense. Thanks a lot, Philip. And Piyush, I know you have been working on AI for the last 15 years or so, even before hundreds of billions of dollars started pouring into it. And you spent almost a decade in the insurance industry. When you are developing AI solutions, do you think that, hey, this AI solution should shrink the gap between the different ecosystem players like healthcare, insurance, patients, or you are more focused on reduction of frauds that may happen within the healthcare ecosystem? What is going on in your mind, or are you thinking about today's problem statements or 10 years down the line, what may look fancy? How are you building AI solutions when you are building for your organizations?
Thanks, Pankaj. It's a very interesting question. There are actually multiple, sections to the question that you asked, and it was very interesting to hear what everybody said. Right? Absolutely, I couldn't agree more with all the speakers. But coming back to, let's start with the first piece that as and I've been, as you mentioned, I've been with U.S. healthcare for about a decade. Then I was in the Indian insurance setup for 2 years. And at the end of the day, they're all corporates, right? So the dollar does come first to a certain extent. Obviously, you're trying to, make health better and, make lives easier for people. Um, so it's a mixed bag, right? You want to solve the health related problem for the population, but at the same time, even the largest of corporates, they want to ensure that there is a ROI at the end of the day, right? There has to be some saving. That doesn't go away. As a research head, I'm a cost. Let me put it that way, right? My team is a cost. So when 5 projects of mine or initiatives of mine don't go anywhere, the sword, is always dangling on the head, right? So it has to make sense at some point in time. It's just the nature of the beast. So yes, they're solving even today's problems, whether it's American healthcare or Indian insurance setup, which I've seen personally firsthand. I've worked and built systems there. And I think as part of that work, new cool stuff has emerged, which would be, life changing or game changing or whatever term we want to use for it. Obviously, in an academic research or more theoretical research, you have something which is further looking out. But I think corporates are definitely focused on today, right? To start with, it goes from there.
Right.
Now, there was other point about fraud and all. Fraud is and there are numbers, right? I mean, the billions of dollars that go in fraud. So fraud is a problem of today. It was there yesterday. It's happening today, and with everything coming in, fraud is just going up and up. The dollar value of how much of money is being lost to fraud, waste, and abuse. If you look at all three of these, is significant. So there's always this challenge. Hey, how can I reduce that? Right? How can I catch fraud before the fraud happens? Right? The Minority Report, if I can refer to that movie, right? That's always a challenge. It's an ongoing challenge. It was a challenge 15 years ago, when I joined United Health Group. It's a challenge today. We built some models back then, which were statistical. Then machine learning came in. Then deep learning came in. Now generative AI is there. The problem is still there. And the problem continues to, it won't go away because the devil also has an R&D department, right? So they're also coming up with new ways to break the system. So it's a cat and mouse game. It'll keep happening. I don't see it ending. But yeah. And the last piece, I think AI definitely has a huge play in the healthcare space. And Dr. Mujtaba started with that point, right? The sheer volume of data. You talk of X-rays, you talk of EMRs, you talk of medical codes. AI is definitely going to add value because it can process that voluminous data relatively quickly. So, you from those billions of records, if I can narrow down to 1,000, which, as Philip just called out, right, which are high probability of a person developing a cancer, then it's much more practical for the doctor or the radiologist or whoever is looking at it to focus on those 1,000 instead of the billion records, right? So tremendous value is there. It's an efficiency game. It's an efficiency game, and it's a long game. It won't happen overnight.
That's pretty interesting perspective. And are you working with the hospital groups at ProHands today?
No, so now I'm out of the healthcare setup for now. ProHands is a enterprise workforce productivity software, so completely different space.
Right.
But yeah, doing some AI there as well. So
fantastic. Thanks a lot, Piyush, for your insights. Now I have a very interesting question, and I'm going to open the floor for everybody. If you had a magic wand, what one transformation, only one transformation, you cannot talk about two, would you bring upon the healthcare ecosystem? Just one. Yeah, go ahead, Piyush.
so let me, I was the last. I'll get going with this one. I'm sure all of you have seen Star Trek. Dr. McCoy used to have a handheld scanner, and he would just, and he would tell how many bones are broken of Spock, and where there is this internal bleeding happening. Non-invasive scanning technique is what I want with my magic wand. That's my vision of healthcare.
I'm sure Philip would have an answer for that. Philip, please go ahead. Do you have an
Wow, no, I'm actually loving it. I mean, that's much more far-reaching. For me, it's a bit more pragmatic. I mean, I think if the one thing that we could do is just have digitized records, because there's this reference to the billions of records globally and how much AI can do with that. Right now, AI is largely ignorant around any sort of African and really even like emerging markets, right? The data just simply isn't there. All of these records that are on paper have never been scanned. So everything that AI knows about is really kind of Western, and well, there's kind of like the two poles, right? So there's the Chinese AI, and there's this Silicon Valley AI, and it kind of knows all the people that are in those orbits. So if we could just have the digital records, if we could have the an EMR system, or even any sort of just capture of the human realities for the the billions of people that are in the majority of the world. AI's awareness of reality and the problems that AI would be focused on solving would shift materially. So yeah, if I could wave my magic wand, it would just be to digitize all the records of African patients.
Fantastic. Thanks a lot, Philip. And again, that's solving today's problem statement, which is pretty which is pretty aligned with your earlier answer. So thanks a lot for that. William, may I request you to go next, please?
Absolutely. What everybody shared, I think it's very, very insightful, and it just adds up to the whole idea of how impactful AI could be. But from my perspective, I'm gonna look at a different angle. I think single point AI tools and agents will be pivotal in the next healthcare revolution, but an ecosystem level intelligent layer that lands and interconnects the value chain will accelerate transformation, right? While most are currently betting on AI scribes, I'm sure Dr. Mujtaba will talk about AI scribes, prescription bots, billing co-pilots. These are very pivotal, very vital, but inherently very low. They risk new data silos, lack holistic context, and miss patterns across vast systems. We believe the real transformations need an intelligent layer, a self-learning network that learns from multi-institution data in real time, predicts, prescribes, and seamlessly coordinates care. This is how I would look at it.
Thank you. Thanks a lot, William. Daidipya, you got the magic wand. What would you do with that?
I think all the points were very valid and much needed in current scenario. I would still go and back Philip up. I really think there is a huge database which is available across, but there is the digitization is still pending, and eventually that impacts a lot to every category. So if I talk about if I look from a patient's perspective, I do not have the backup. I do not know how I'm allergic to, what I'm allergic to, what all DNA samples are taken in the past, whether they are taken, not taken, what is something which I should be doing to improve my health, it is not available. So I think that is the first step. If I look from hospital's perspective, eventually they have the database, but they are not able to speed it up. There is a huge timeline which gets impacted for the patients. Eventually, that is not cost effective for the hospital itself. Operationally, talking about insurance panelments, talking about processing of the documentation, paperwork, everything is messed up. So it's a huge space. It's getting organized as well, but I on the AI side, on the back record side, so that process can be organized a lot, and it can speed up a lot of things. So personally, for me, I would look at social ROI and the financial ROI both. If my people are not aware about what they should be, they will not be able to take advantage of the facilities which are actually available right in front of their eyes.
Fantastic. Thanks a lot, Daidipya. Dr. Mujtaba, please, what would you do with that magic wand?
I think I'll grab everyone's magic wands together here because so something very important that all stakeholders have to understand is that AI in healthcare is no longer an option. It's something that's inevitable and it's going to come. And it's the mindset that has to change, that it's not healthcare industry versus technology. Rather, it's more of a collaborative option, and it's healthcare industry with technology. That's how we have to look at it. And we have, as healthcare providers and managers, administrators, we need to understand that they are the right people who need to do the right thing. So as William had initially mentioned, that we leave so we can have the operations, the patient relationship, clinical expertise with us, but we leave the tech things for the tech guys so that we can collaborate together. And as Daidipya finally also mentioned, that the vision in terms of the investors, how ROI is actually visualized. It has to definitely have that social angle, that an outcome along with sustainability and profitability has to go hand in hand, rather than seeing it into different ROI models.
Fantastic. Thanks a lot, Dr. Mujtaba. Thanks actually to all the panelists for sharing your insights today. What I understood from this session is that AI in healthcare is no longer an option. It is very much required. And it may solve data digitization problem. It may solve the affordability, accessibility problem. It may also solve the shortage of nursing healthcare staff problem that we may be seeing in Africa today and also in other parts of the world. The fastest, safest, and probably most sustainable path is partnership. If hospital groups, healthcare institutions are able to partner with the specialist companies like LyfPlus or other healthcare startups, bringing new innovative solutions, or even Hexa Health, then these innovative solution providers will bring the infrastructure, they will bring AI capabilities, they will do all the integration and solve these hospital groups problem statements very, very quickly, very, very effectively. So the future of care delivery is not hospital versus AI, not hospital versus technology, but it is a combined sort of partnership, collective effort where both the technologies and hospital groups are creating a better care delivery ecosystem for the patients. So again, thanks a lot for your insights, for your guidance today. And with that, I would change the gear a bit. We will transition from the panel discussion to a quick presentation from William, CEO and founder of LyfPlus. William, please feel free to share your screen, walk us through the LyfPlus presentation to show what exactly you are building and what is your solution offering. And obviously, William will be very much willing to take questions, respond to difficult, easy questions that you may have, or probably hear your guidance on, hey, this is how you need to work on your GTM or your channel strategy or on your product roadmap. So William, please, floor is yours.
Okay, thank you, Pankaj. I'll go ahead and try to share my screen. Unfortunately, I know that time is not on our side, so I'll try to go through it as quickly as possible. Okay, can everybody see my screen?
It is coming up. Yep, now we see your screen. Please go ahead.
Okay, I'll try to. All right. So after an insightful session, thank you, everybody. Thank you for such powerful insights. Again, we are LyfPlus, and LyfPlus is a digital health company. We've been operational since 2022, and initially we started as a two-sided platform, essentially connecting healthcare providers and patients. And since then, we have been able to work with regulators in the context of Tanzania. The former head of department of the Ministry of Health, the ICT department, Information and Communication Technology, is on this panel as well. We worked with them to co-develop the first health policies that now regulate all digital health companies in the country. We have onboarded more than 475 health facilities, which is now the largest network of healthcare providers. We've worked with global renowned clients, the like of the German corporation, where they contracted us to provide our services to certain patient groups that were disadvantaged. We were awarded the best startup of the year, 2022, by the Prime Minister. We are heading towards that $1 million mark, and we are hitting those. That $1 million ARR very soon. We have generated more than 800,000 revenue generated from 110,000 appointments since inception, and we've raised capital from world-renowned investors as well. So that's a little bit of a background of who we are, and really the challenge that we're focusing on with AI. A lot of people are focusing on single point AI solutions. We have a different approach. We're looking at the problem as an ecosystem problem, and this is really based off of our experience with the healthcare providers that we're working with. Dr. Mujtaba is here as well. He made sure his experience with working with us. But the problem that we're focusing on is fragmented healthcare ecosystem, where health facilities operate in distinct islands, almost, causing issues like systemic blindness, inefficient use of capacity, suboptimal operations, disconnected referrals, and patient leakage. The data is 90% of the whole health infrastructure is fragmented and systematically blind, much like how aviation was before 2004, banks before 2008, and taxis before ride-hailing. Today, aviation uses radar system to synchronize data in real time for safety. Banks use SWIFT to connect, share information, and move money securely. Before 2004, airlines didn't share flight data in real time. Each managed its own schedule, congestion, and efficiencies forced standardization. Same as banks before 2008, banks did not share risk data, and then the financial crisis revealed the cost of opacity. That's the same for ride-hailing. After 2010, ride-hailing redefined real-time coordination, reducing inefficiencies through digital integration. This is where healthcare is at current state. Hospitals, clinics, labs, and insurers all work in silos. They rely on manual coordination with no interoperability and 0% intelligence. This leads to over $2 trillion in wasted spending yearly globally. as a result of an average loss of 30% of outpatient revenue on an average health facility due to operational blindness and patient leakage. So our solution we're building, and what LyfPlus is building, we're really focused on what we call an intelligent healthcare supercluster, which is a coordinating backbone for healthcare, much like how SWIFT standardizes communication between banks, radar for real-time visibility, and GPS for dynamic coordination in the ride-hailing industry. And I'm using these metaphors to try to communicate what we're building here. So we call it an intelligent healthcare supercluster platform, connecting health facilities in networks to optimize operation, triage patients, and enhance clinical decision. This ecosystem level connectivity and intelligence allows efficient, faster, and smarter operations within the facilities themselves and across the network. We're building a platform based on 3 pillars. That is, first, standardizing communication and trust between different institutions, like SWIFT and banking, providing real-time visibility through the real-time dashboards into patient flow, capacity, and resource utilization across various facilities like radar and like GPS, dynamic matching of patients with providers, eliminating long wait times, overcrowding, and patient leakage. So just to give you an idea of how the platform works, the architecture design of the solution is a 3-layered operational tech stack at a hospital level, in a hospital level, and at a patient point of contact. All these integrate 2-way data pipeline, feeding the model into one coordinating backbone. So the first layer is the intra-hospital intelligence, which is the real-time dashboards which I spoke about. Within the hospitals, LyfPlus works as an AI orchestration layer that plugs into the existing EMR, integrating real-time operation, administrative, and clinical data through data standards, which are very popular, HL7, FHAR, and automating tasks like pre-visit screening, real-time visit suggestions, and clinical plan drafting. So hospitals start operating with less paperwork, fewer manual processing, and better data for every clinical decision. Anyone who has worked in a hospital knows how much is wasted jumping from between systems, locating files, and entering notes. This layer removes all that chaos. And then the second layer is the inter-hospital intelligence, the ecosystem brain. Across health facilities, LyfPlus becomes the coordinating fabric. Now, hospitals, labs, and pharmacies, insurers can finally see each other live. Things like patient flow, referral status, capacity, diagnostic loads, and even bottlenecks across the ecosystem becomes more visible instantly. And this turns disconnected institutions into connected network where workload, capacity, and patient routing can finally be optimized. And then the third layer is the patient layer, which is the patient level intelligence, bringing directly to the same intelligence fabric. The record test care journey move with them across hospitals, across borders, and the app helps them navigate the system, follow treatment plans, and avoid repeat tests, which causes a lot of delayed treatment as well as increased costs on the patient side. So that is a feel of how the architecture design really works. Now, I would like to jump into the existing gaps, because you might wonder, what are the gaps that are currently existing and what are we really solving? So first is manual referrals. Today, referrals are manual through paper, WhatsApp, phone calls, no tracking, no feedback. Hospitals always know where the patient, don't know where the patient went, et cetera, et cetera. So with LyfPlus, what we're building really is an intelligence fabric that now allows digital as well as dynamic referral loop to the interconnected network. Another issue is operational blindness. The hospitals don't know which facility has capacity, which lab is overloaded, or which patient bottlenecks are currently existing. With LyfPlus, we provide real-time dashboards showing patient flow, capacity, and resources across facility. Imagine knowing in real time which lab can take your test now, or which facility has free beds, that type of level of visibility. Another layer is care navigation gap. Patients move through systems guessing, no visibility, which hospitals are less crowded, has specialists they know, et cetera, et cetera. But with LyfPlus, we provide dynamic matching of patients to the right facility based on availability, specialty, as well as workload, reducing waiting, repeated tests, and give patients the actual coordinated care experience that they need. So this is more of an ecosystem approach of our solution. We are leveraging our vast network of healthcare providers that we're currently working with. We have onboarded more than 407 doctors. We're working with 475 hospitals, and we're generating vast amount of data, which will now feed our model. So that's a description of how our solution works.
I'm sorry, we'll have to be conscious of the time. So if we can take questions and feedback guidance from the panelists, then that would be great. Or you want to present probably one more slide? Yeah.
I'm trying to be conscious of time. I would like to talk about traction, the use cases and doctors' experiences, et cetera, but because this is more of a solution pitch, I would stick to, what we provide and our the angle that we're solving in terms of the problem.
Fantastic. Thanks a lot, William, for the quick presentation. I know we had a very little time, but any questions, any guidance, any insights from the panelists?
I think that operational dashboard about that operational that blindness aspect is applicable everywhere. Whether it's the first world or the third world or any world, the fact that if you can know in real time where you can get your lab test done or where you have free beds in case of an emergency or any situation, I think that has applicability worldwide. I really love that, William.
Thank you.
Yes.
Yeah.
I really liked you're actually giving options to the patients and the dynamic facility matching which you're doing. I think that's a huge gap which needs and the automated eligibility, claim verification, and fraud detection. This is a huge space which needs to be catered upon. So I think that's a huge advancement towards this platform.
Thank you.
Yeah, I think William, you didn't get a chance to get into kind of the ROI, but we'll say, I've known this from prior interactions with you, but what I really love is that it's really practical, that the hospitals are able to actually see this not as a cost center, but as almost as a profit center, that it's something that is generating returns for them that is measurable, and that just makes the adoption, the sales cycle and the adoption utilization much faster. One of the comments earlier was that an R&D is oftentimes viewed as a cost center in hospitals, but you've actually taken this tech and created something that doesn't have to be seen as an expense.
Thanks a lot.
Absolutely. I would have really loved to get into, the commercial partnership that we enter with hospitals, and that, they do not require, it's a $0 onboarding fee. Our business model is revenue sharing based on, the number of appointments and the number of, visits that they get. So that's our business model.
Thank you. Thanks a lot, William. Dr. Mujtaba, please go ahead.
Thank you, William. I think William has done a lovely work on the development part, and I've known William, I think, for 2 years now, and I see where LyfPlus is going, and I commend him on his achievements. I'll just ask a simple question. In terms of, so it's a business of data, and at the moment, as we know that in the Eastern African countries or in Tanzania, particularly also in Zanzibar, the struggle that we're facing is more in terms of data safety, patients' data safety, the regulation of the data, and all that. So how does LyfPlus also try to address those? You said you have policymakers on the panelists today, and that's lovely to hear. So maybe some insights on that.
Absolutely. Thank you for that question, Dr. Mujtaba. I think the last time when you were working at Apollo, that's the first question that you gave to me as I came to sell the product. But yes, we are compliant to all the data standards, HIPAA, as well as the Europe GDPR. You know, everything to do with role access entry, everything to do with security standards at the level of the provider, at the level of data sharing and encryption, and you know, all those regulatory standards that are required for data safety. You know, we're really keen, and we've built our system looking into those. I would like to get into the technicality of that, but Kevin, my CTO, is here. I think he can really delve into, you know, the technicality and the complexity of security that we've built into this.
Thank you. Thanks, William. Again, thanks, William, for the quick presentation. Thanks to all the panelists for your feedback, your guidance, your insights. Really appreciate your time today. And I hope we can keep reconnecting with each other to see how we can support each other in driving new initiatives, in strengthening each other's network and initiatives and projects. So thanks a lot for your time today. And we'll see you later. Thank you, everybody. Take care. Bye.
Thank you.
Thank you.